I'm Melissa. I'm going to be the co-host for today. And we have an awesome guest with us. We have Alex McNulty from McNulty Wellness Collective. Alex is a clinical social worker who received her training at University of Pennsylvania and specializes in multiple areas, obsessive compulsive disorder, anxiety disorders, and also provides therapy in the area of postpartum, actually extending kind of across the spectrum from planning pregnancy to pregnancy and then postpartum and beyond. So, welcome, Alex.
Thank you, Melissa. Thank you so much for having me on here. It's been a pleasure getting to know you throughout this process. And as we talked about before, I think what what you and Julie are doing is so important, and just having kind of that, the health information catered to a specific age group is really needed.
Thank you. I greatly appreciate that. And so does Julie. And we're so happy to have you here because there are so many topics I think that which is so much a part of YMyHealth that people are not talking about enough, that people can't find specific
Mhm.
information, also specific support in terms of therapy in certain areas. And so I'm really excited to talk with you today about really the postpartum period and mental health support during that time, because there are a lot of things people don't anticipate, right?
Mhm.
As they go to pregnancy and then after delivery that they're going to experience. So at your practice, McNulty Wellness Collective, which is just phenomenal, you offer so many different types of therapy services in specialized areas. And we were curious, Julie and I, kind of what made you decide to specifically offer therapy in the area of pregnancy and postpartum and beyond?
Yeah, no, for sure. And I mean, I think while there's a lot of different specialized areas, there's often so much overlap. So, I think when I started my private practice 2.5 years ago, kind of had my idea as far as anxiety, OCD, and I started to realize how much perfectionism was playing a role. And then that kind of developed into, okay, there's a significant amount of body image and disordered eating, just given my population.
Yeah,
That kind of naturally then blended into issues that women would experience postpartum, and just became kind of more and more common. And I mean, to be transparent, a lot of that grew out of my own personal experience of becoming a mom 2 years ago. So I started to become
awesome.
just much more interested in kind of like clinically how to treat and specialize in this area in a time in a woman's life. I decided to offer therapy specifically in the perinatal period because it's a time where women just, to put it plainly, really need a lot of support. And there's a lot of information out there. Like, trust me, there is no lack of information. Anyone on the internet can tell you that. But this is an area where I think a lot of the information becomes not only overwhelming, but tends to make moms feel a lot worse. And
Yeah.
unfortunately, a lot of advice that people tend to get, maybe well intentioned, not often well received, and not often what is helpful. So, I felt kind of passionate about being able to help other moms navigate this time without inadvertently, contributing to the feelings they might be experiencing.
Oh, I really appreciate that. And that's very true. It is very overwhelming when you look at some of the information on the internet, which we all know we try to encourage people not to necessarily, right, make that their go-to, but before they go and they see a specialist. But let's be honest, our generation with
Mhm.
our right, with our busy schedules, it's kind of like the pre-research before you go and you see the mental health therapist,
Mhm.
your doctor, other, healthcare professionals. And so that's wonderful that you're, thought to yourself that there was something from your not only from your lived experience, but also from the types of information that you honestly that you were seeing, that there was a need. And, I guess really to start, also just really kind of wondering how is it possible when you think about this, um, that we think about it and in society, pregnancy is supposed to be this time that's the happiest time in your life. But it can also be one of the most mentally challenging if you do not, even if you don't have any
Mhm.
medical complications, like there are things that you might not realize could come up. So just kind of those 2 things, it seems like such polar opposites of the way things can go.
Oh my gosh, how much time do you have? I think that that question is like exactly the culprit of so many issues. Our society tends to romanticize pregnancy and motherhood, and yet at the same time doesn't actually provide any structural support to make it feasible or make it the wonderful time that everyone, hopes that it could be. This is, of course, paid parental leave, affordable childcare.
Yes.
The list could go on and on and on, of course, but at the end of the day, there's an enormous gap between expectation and the support that is given, and moms are unfortunately expected to fill in that gap.
No, excellent point. You're making me think of something I was listening to yesterday that's related. There's a webinar, it was a big event, but they had it where people could tune in virtually at the
Mhm.
Women's Alzheimer's Movement, part of the Cleveland Clinic out in California. And one of the women who's one of the researchers in Alzheimer's research got up and said something about how not only does the the entire program and center support women's actual research, but it actually supports the women researchers. And she was talking about how during her pregnancy and her maternity leave, working with them, how supportive they were. So to your point, that support you can't always find it everywhere, which is why it was notable that she highlighted it. But that
Mhm.
is one of the big issues here that women in our society face. And in terms of postpartum depression. We hear that term, it's widely known, the actual
Mhm.
term. Um, but are there other forms of mental health challenges during the postpartum period that can significantly impact the quality of life that people don't recognize or know about until maybe they experience it themselves?
Yeah, absolutely, and it's interesting because I think, in society, we say postpartum, and I think the implication is often postpartum depression. You might hear somebody say like, "Oh, I heard she had postpartum."
Yeah.
What does that mean? Postpartum is the period after pregnancy. Typically, as therapists, we tend to use the phrase perinatal, which encompasses, pregnancy, possible, experience after loss, the experience after actually having the baby and bringing it earthside. So again, it's just very interesting how we use the word postpartum to mean one thing when it's,
Yeah.
it means so many different things.
Uh-huh.
And as far as diagnoses or things to really pay attention to, I mean, I think that we're starting to pay a little bit more attention to experiences women can have aside from postpartum depression. But what I actually see, quite commonly is
Mm.
postpartum anxiety, postpartum
Sure.
OCD, and then a little less frequently, but definitely things to pay attention to are postpartum PTSD,
Right.
following a traumatic birth or loss or significant event. Perinatal psychosis is obviously something to pay attention to. And even bipolar disorder, there's not necessarily like postpartum bipolar where somebody has bipolar and then it goes away after a period of time.
Right.
But I believe the statistic is about 50% of women develop who do receive a diagnosis
Mhm.
of bipolar disorder receive that actually postpartum during that
Oh,
phase.
wow.
And I think a lot of people find that surprising. So,
Yeah.
the point being, there are a lot of significant changes that a woman can face. And these are just the diagnoses. I mean, as far as other issues,
Yeah.
what I commonly see are things like postpartum rage, loss of identity, challenges with body image.
Yeah.
It's a significant transition that a woman goes through. And we use the term matrescence to kind of describe the experience that moms have during this transition. The focus is often on the baby and the baby's health and, the baby, like I said, coming earthside and, becoming a person. Yay, they're here. Moms undergo such a significant, transition that is comparable to adolescence, but we're not often given the
Wow.
space to do so or the attention, honestly, that is deserved.
No, no, we are not, and you're exactly right. And are there some women that are more at risk for developing the conditions that you were talking about than others?
Yeah, I mean, well, jokingly, I think the most obvious risk factor is living in the United States, but
Oh, no, 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 you're right. Funny, but also true.
yeah,
The way our
unfortunately, that goes without
Unfortunately,
saying.
let's all be honest, the way the work structure, I mean, some places do not even offer 3 months of
Yeah.
paid, yeah, maternity leave. They act like it's this little small event, and then you're just no big deal. Yeah.
Yeah. No, for sure. And I mean, even when it is offered, it's, Sometimes you have to tack on and use up your PTO.
That's
Sometimes you have
right.
to use short-term disability, which is just very telling how we kind of refer to that time.
Oh, yeah.
Or and I mean, also too, not everybody has these benefits. It's, a time in someone's life where they really are going through such a significant change. And sometimes we're not really encouraged to take the full time, or even when we do, there's kind of strings attached. And at the end of the day, in our country, it's tied to somebody's employment status. So if you're not working or if you're not considered a full time employee, you're not going to be eligible for these benefits. And they're crucial, they are necessary.
Absolutely.
So yeah, so I would say, we're all at risk kind of being unfortunately in a very developed country that has pretty abysmal support. But I would say as far as other risk factors, of course, if somebody had pre-existing mental health conditions or struggles with
Right.
their mental health, you might want to kind of keep your guard up a little bit more. But aside from that, I mean, I think it's important to keep in mind, like, yes, there are a lot of structural changes to the brain and hormonal changes women experience, but a lot of other risk factors are environmental in nature. So we
Yes.
want to pay attention to folks that are, you know, operating as single parents or doing this alone or have financial stress or a baby in the NICU, a
Yeah.
traumatizing or disappointing birth experience, being in a marginalized community, the queer and trans community, women of color.
Mm, true.
There are a lot of factors that, can contribute. So it's extremely multi-causal. It would be nice if there was like one risk factor we could pay
Of
attention to,
course.
but it's a combination of a lot of things.
No, absolutely. Absolutely true. And I think one of the challenges for a lot of people, both those looking kind of on the outside in and then those who are currently pregnant is kind of knowing and have recently delivered as well, how to distinguish between baby blues and
Mhm.
postpartum depression because
Mhm.
there's a big difference there. So if you can kind of tell us a little bit about that.
Yeah, no, absolutely. And this is a common question I see come up a lot because I think
Yeah.
it's often finding that balance between normalizing someone's
Yeah.
experience without pathologizing and then also kind of like figuring out like when does it require more intervention, different forms of treatment and stuff like that. I would say it's probably the most helpful to focus on two factors, one being duration and then the other one being functioning. So baby blues tend to last give or take 2 weeks, I think is the standard. I mean, of course, for
Yeah.
some it could be shorter, some it could be longer. Postpartum depression, of course, lasts much longer than that, especially if left untreated and things aren't changing in a woman's life. Baby blues also typically occur kind of with that big hormonal shift that takes place right after giving birth.
Oh,
Postpartum can take place, you know, usually within the first year postpartum. So I would say in addition to duration, I would pay attention to functioning. They can look very similar, which is very confusing and
yeah.
challenging for a lot of people. With baby blues, you can expect a lot of tearfulness, mood swings, trouble focusing, concentrating, and yet still be able to function. And I guess it's challenging because what does functioning actually mean? But I
Right.
would say with depression, it's a little bit more of an impairment in functioning,
Mm.
as well as some other sorts of things as far as like really like withdrawing, whether it's socially or from activities that somebody might have enjoyed in the past. Again, understanding that a lot of these things are more challenging, but it's almost
Yeah.
more of that like lack of interest or more of like a why bother sort of attitude,
Gotcha.
um, loss of appetite, worthlessness, guilt, and I would say hopelessness is obviously something to pay attention to. And of course, thoughts of harming yourself or the baby would be absolutely reasons to seek help.
Yeah, no, absolutely, absolutely. And there's also postpartum anxiety, which I know you were mentioning you treated a lot of clients for, and
Mhm.
that's something I think people don't hear about as often as they hear about postpartum depression. Some may not even
Mhm.
really recognize that. I mean, they recognize that they have anxiety about different
Mhm.
things and naturally. So, which we're going to talk about, um, going into a pregnancy, into a delivery, and then after the baby is born. Um, but, when it comes to that, I think that would also be very difficult. Kind of, how can we tell the difference between what's a normal level of postpartum anxiety, especially for first time parents, for first time
Mhm.
moms.
Yeah.
Um, and then postpartum anxiety that needs treatment.
For sure. And I think our culture also normalizes a lot of worry or even goes
Mm,
so far to equate worry with being a good mom, which I have a lot of thoughts and
yeah,
feelings about. But there's almost this
that
expectation of like, oh, new moms are supposed to be worried. That just means that
yeah.
you care.
Mhm.
And sometimes it's at a point where I mean, it's incredibly debilitating and it's not that's that's not helpful to mom or a baby. Moms deserve support if their anxiety is feeling unmanageable or out of hand. So I would say again, kind of like, obviously there is an expected level of anxiety, especially like you said, as a
Mm,
first time parent. You don't know what you're doing. I went in, I read all of the books, I did all my research. I'm a therapist. I went in and I was like, why did I bother reading any of this? I have no clue what I'm doing. So, understandably, with a lot of that uncertainty comes anxiety. I would say when to pay a little bit more attention would again be focusing on the functioning of
yeah.
somebody experiencing that anxiety and then also the context. So, it's normal to worry and to check things related to baby safety, especially, like I said, if you've never done this before, you have no
Yeah.
frame of reference. I would say it's helpful to pay attention to if you kind of need that constant reassurance, or
Mm,
you start to get pulled into these what ifs about what might be happening and could be happening despite evidence to show that there's an issue. If you start to doubt what your senses are telling you, so that could be, having the thought, what if the baby's not breathing? You might look on the monitor, see the little chest rise and fall, but then 30 seconds later, what if the baby's not breathing? And starting to kind of doubt
right.
what we know. Physical symptoms are something to pay attention to, kind of the classic anxiety symptoms, heart racing, dizziness, trouble eating or sleeping. I would
Right.
also pay attention to functioning in a sense of avoidance. So while anxiety, of course, is, sometimes a natural part of being a new parent, I'd pay attention to avoidance of leaving the house, avoidance of driving, maybe
Right.
avoidance of letting somebody else help and watch the baby. And sometimes that can even look like avoidance of holding the baby yourself. Something that I think is wildly underdiscussed is perinatal OCD. So I would say if somebody is
Yeah.
experiencing really intrusive thoughts about baby being in danger or intrusive thoughts that are really upsetting in nature. I This is something I experienced to an extent when I had my son. I started to experience these 3 a.m. thoughts of don't bother getting attached to him, he's gonna die. And, I'm a therapist. I know what intrusive thoughts are, and that didn't stop that from being excruciatingly horrifying to
Of
experience in the middle of
course.
the night, and, I think we need to pay more attention to these sorts of thoughts. Women are often afraid to speak about them because they might feel like they're going crazy or, you
Yes.
hear these stories that are very scary in the news, but, I would say adjacent to postpartum anxiety, we absolutely wanna pay attention to signs of OCD as well.
Yeah, no, I really appreciate you speaking about that because that is something that we hear about very little.
Mhm.
And I think is so important to talk about. Absolutely. And knowing this, knowing, whether it is postpartum OCD, postpartum anxiety you're experiencing, or postpartum depression, when is it time for someone who is experiencing the types of symptoms that you're talking about during this period in their life to seek professional help?
I mean, I'm biased, but I would say anytime, right? Like, I think, sometimes, especially, there's like a mother martyr syndrome of like, oh, if I'm suffering, that's just part of it. And
Mhm.
nobody has to go through this alone. So I just want to encourage new parents. You don't have to wait until it's bad enough. There's not
Yeah.
necessarily this magical threshold of, oh, well, until I'm there, I'll be fine. I'll suck it up. I'll just deal with it. I mean, at the end of the day, anyone would benefit from support
Of course.
during this like extremely
Yeah.
significant time. I would say if emotions or symptoms become more pervasive and maybe less situational and kind of are more unchanging, that's probably a good indicator to definitely talk to somebody. But at the end of the day, I mean, anytime. I encourage folks to start when you become pregnant to kind of have that ongoing support during the entire transition. I think we should normalize it.
I agree we should normalize it, and I think it's a brilliant idea. And, in your practice, what are some of the common experiences that women during their postpartum period have come to seek your help and therapy for? And I know it kind of, I'm sure, runs the spectrum of all these different conditions that we're talking about.
Yeah, for sure. And I mean, you know, sometimes people might come in with a clear sense of like, I think I'm experiencing postpartum depression or
Mhm.
anxiety, but a lot of the time it's just this sense of this is feeling really, really heavy and I could use
Yeah.
some support. I could use someone helping me with it. The issues that I see probably the most frequently are the shoulds and the guilt that comes up during motherhood. Moms constantly feel like they're doing the wrong thing. And
Mm.
it makes sense because according to somebody on the internet, you are. So I
Yeah.
would say, you know, a lot of the mom guilt, I see that kind of going on across the board, separate of diagnosis or someone's circumstance.
Oh,
So a
wow.
lot of the work becomes, you know, while there is, of course, a focus on reducing symptoms and improving
Sure.
quality of life and functioning, a lot of the time it's just helping moms build trust in themselves. I do think that new parents possess an innate wisdom, but it gets drowned out by all of that like external noise. So we want to minimize that. And I don't tend to give advice in my practice. That's just not my role as a therapist. But
Sure.
there is always one piece of advice which I give new moms, which is during that initial phase, stay off social media.
No, that's great advice, and that's very interesting to hear too. The other thing, that is such a pressing issue of our time that you're making me think of as well, so many women today who are of
Mhm,
childbearing age are also working careers simultaneously outside the
mhm,
home. And so have you experienced where you have some people when you're talking about the shoulds, um, and things like that, I wonder too, the kind of the difficulty and the balance or the guilt from
mhm,
not being able to be there every
mhm.
moment, if you've talked with people about that as well.
Yeah, absolutely. I work with a lot of, you know, women who would probably identify as very high functioning and
Yeah,
professional women. So absolutely. And I also kind of hate the phrase work life balance because it implies this seesaw where if you're focused at home, then you're not focused at work, and it vice
yeah,
versa. It implies that they are at odds with one another, which tends to make women feel like they can never be enough anywhere. So I prefer to use the term work life integration. I find that it just kind of
oh,
is a little
that's
bit more
great.
realistic as far as integrating kind of this new identity with your old identity. And I think for
Mhm.
professional moms, there's a lot of guilt, not even just from the childcare aspect, but also about where your focus lies and the things that you care about. And, you know, I remember initially when I first had my son,
Mhm.
I was excited to return to work, but then I also felt like I couldn't talk about that. And while I'm
Um,
fortunate enough to love my job and love what I do, felt really guilty that I was looking forward to returning to those other aspects of myself as if it meant that I was not paying enough attention to my son. So it's again, it's more of that integration than that balance for sure.
that's a very, very interesting point, and I bet a lot of people feel that way, and it's okay to be excited. But to your point, from a
Mhm,
societal what society tells us from a societal perspective, it's
mhm,
not as normalized that that's an okay way to be. But no, I appreciate that very much. And when it comes to helping women with address all these different experiences that they're having, uh, what are some of the types of therapy and therapeutic strategies that you provide to your clients to help them navigate, whether it be postpartum anxiety or depression or OCD to heal? And I know that's a lot of conditions with different, specific
sure.
areas, but just kind of across the board,
Mhm.
therapeutic strategy would be really helpful for people to hear.
Yeah, absolutely. And of course, you're absolutely right. Different presenting issues require different interventions. Across the board, I love acceptance and commitment therapy in general. I especially love it for the perinatal period because it allows us to relate to our thoughts and our emotions differently.
Mm,
And there's going to be a lot of challenging and painful thoughts and emotions that will arise at this time. With traditional CBT, there's a lot of focus on kind of challenging your thoughts and changing them in order to change our emotions. I prefer to help clients relate to their internal experiences differently
mm,
so that they hold less power. You know, like I said, it's not uncommon for people to experience some challenging internal experiences, but rather than letting them take hold over our actions, we want to control our actions. So, kind of returning to our value system, how we're showing up and feeling good enough and challenging a lot of those shoulds can be
yeah.
really important during this time. So I would say cognitively, those are probably
Mhm.
my favorite strategies to practice. And then, you know, of course, a focus on foundations, nourishment through food, sleep, which I know, haha, for new
Yeah.
parents, but, oftentimes even suggesting, if you have a partner at home, can they take a shift? It's okay to do that. Yes, I know
Mm,
they may be working and you're not right now.
yeah.
You still need to sleep, and kind of stressing the importance within, the context of their home environment. Getting enough water, sunlight, movement, socialization.
Mm,
We want to focus on these foundations because if we don't take care of the body,
yeah.
and the whole system and the whole person, trying to focus sometimes on those cognitive strategies are like, I often compare it to like picking out the countertops without the basement being built. Like, we want to make sure that the whole person is taken care of too.
That's a great analogy, and very, very true, and I think sometimes it's easy to forget about that. So I
Mm,
appreciate you bringing that up and sharing that with us. And in terms of timeline, and obviously it varies person to person, but I think people also kind of wonder if they come in, they see you, uh, what would you say is kind of the typical timeline for treatment in terms of seeing improvement? For someone who is living with whether it be postpartum depression, anxiety, or OCD.
yeah, for sure. I mean, obviously, the annoying therapist answer is that it depends, but
Of
it
course.
really does in actuality. It depends on a person's goals and what they're presenting with. And also, it's not uncommon for those goals to change. If we're working on,
Sure.
an acute issue in stabilization, I could say that would take a few weeks. And while I'm not myself a medication prescriber, often those are circumstances where medication might play a role. As far as, some of the emotional regulation stuff, identity shifts, those are things that might change over a few months. And, if there's anything to be true during the newborn and kind of, baby
Mhm.
phase, things change very rapidly. So also
Mhm.
paying attention to, while we want to put the focus on a person's quality of life and improvement of their well being, there's a lot of changes that will take place, especially during that first year, as far as what their life looks like. So it
Yeah.
really all depends based on kind of the context of their circumstance.
No, that makes complete sense. But I think the important thing though is for people to know and and I'm sure you've heard this from clients in the past, like to know that they will get better, that things will get better and really uh coming and finding someone who specializes in therapy in this area is gonna make such a difference.
Yeah, absolutely. I think it's important to know that there is a light at the end of the tunnel, that things are temporary, and sometimes we lose perspective, right? Just because
Yeah,
of, our own brain shifts that we're quite literally experiencing. But also just being in this bubble, therapy can really be helpful, just kind of helping somebody zoom out and see things a
oh
little
sure.
bit, with a little bit more clarity.
No, absolutely true. And in your years of practice, are there one or two or more experiences with helping clients that has stood out for you um, in this particular time in their lives? And what has surprised you about those experiences as a therapist?
Yeah, sure. I mean, don't want to speak too specifically, so the things
Of
that are coming to
course.
my mind are current clients, but I would say in general, what I tend to be the most surprised about is, and I know this, and yet I'm always just so taken aback by how therapeutic it can be to just simply say to somebody, "Yeah, that makes sense. I get that." And I
Really?
think sometimes, especially if somebody's not familiar with therapy or, is coming in with a lot of shame, they're almost like bracing, right? Somebody's opening
Yeah.
up to you about how they're experiencing their experience, they're expressing their vulnerability. And even just the most powerful intervention sometimes is being like, yeah, it makes sense to feel that way.
Yeah.
You can just like see the exhale take place. And it's always just so shocking to me how transformative that can be, just to have a place where you're not judged and you can speak freely. And these are often invisible struggles that people are experiencing. So, yes, while of course therapists, we have our own specific clinical interventions, and absolutely, I like to, believe in what we do.
Of
There's
course.
so much power in just being there and providing that space to just focus on yourself and just breathe and just let it all out without judgment.
Oh, that's very, very interesting to hear, and also makes sense based on as you're talking about kind of the environment in which women's health is currently and has been for
Mhm.
a long time taken care of in our country, but also when it comes to pregnancy within women's health and
Sure.
all the different factors that can make things very stressful, even just leading in from the start. And,
Mhm.
what would you like people to know most about postpartum anxiety and depression?
If someone's struggling, doesn't mean anything about them as a mom or how much they care about their kid. And I think that's a common fear that I see come up
Sure.
across the board. So not only do I want people to understand how common it is, but that it exists so separately from somebody's care and their love, because a lot of the time somebody might feel so depressed or so anxious that they might struggle to bond with their baby, which also for everybody doesn't happen, in the way they depict in movies. It's a relationship. It takes time to build much of the time. Um, but these issues are often exaggerated because new moms care so much and they're so debilitated by the lack of support and the societal expectations and the changes they're experiencing that, sometimes it might not appear that way, but at the end of the
Mhm.
day, I think we need to give women the space to, figure it out and, to just feel what they feel without that sense of, oh, well, at least this or at least that, or oh, shouldn't you be
Mhm.
grateful?
Oh, no, that's very helpful to hear. And I think so many people in our generation, we always want to support our friends. And a
Mhm,
lot of people are in a different place when you think about it. Um, I think more so in our generation, the previous generations, where you have some friends who are at the point that they already have children, some who are getting ready to have their first child, and some who
mhm.
are not partnered yet and have not had children yet. And so I think people all really wanna help one another, and so I was wondering kind of how do you think we should talk to our friends or our loved ones, whether it's cousins or siblings, about these conditions during this time if we see them struggling? What would be the best way to help them?
Yeah, for sure. I think it's a great question. And at the end of the day, I think people want to help, right? But,
Yes.
sometimes people might not know how. I think also, too, if it's foreign, like you said, we're on totally different stages of life.
Yes.
And, sometimes people are so afraid of saying the wrong thing that they say
Exactly.
nothing. And that obviously doesn't help. So, I mean, at the end of the day, I think validate, listen, say it makes sense, don't be quick to problem solve, as somebody's friend or support person, you're not responsible for problem solving. You're not responsible for being their therapist. You're just sitting there to listen, right? So it's not starting with sentences with at least or trying to minimize, but just
Mhm.
giving people the space to express how they feel, knowing that emotions are complex and, multiple emotions can exist at once. So, somebody can be really struggling and be very grateful for the experience that they're having. I mean, I think motherhood and the postpartum period is filled with a lot of contradictions. A
Right.
lot of it's just giving somebody space to have them. And then as far as like support, minimize decisions that need to be made. I think some of the most helpful things that people did for me during the postpartum period were just, hey, I dropped off food. It's outside. And,
Yeah.
there's no expectation, no decision on my end. It's just, I want to give you support. I don't want to contribute to your mental load and have you tell me what you need. Just here it is. It's really just sitting in the shit with somebody, honestly, sometimes.
No, understandably so, but that's all excellent advice and things for us to think about because people, as you said, really do want to help.
Mhm.
They really do. Well, this has been a wonderful conversation. I know that so many people uh, will hear about certain aspects, which is what I find so interesting about certain aspects of the postpartum period, but definitely not all the things that we talked about by any means today, and are searching for information on that. And so I know it's going to be helpful to so many. And and before we go, would love to know where people can find you.
Yeah, for sure. Eventually on social media, but that that'll come after baby too. Um, People can find me on my website. I would say that's probably the best place. That's mcnultywellness.com. I love connecting with people. I have a significant amount of people that will even reach out just being like, I don't need services or just in general, I want to help in any way that I can. So if people need help finding a therapist or accessing resources, I always want to be a resource of my own.
Awesome, awesome. Well, we will definitely include that information, in the show notes too, a direct link to the website. And
Great.
so, yeah. But thank you so much for shedding light on the postpartum period and really also bringing in the context about kind of the way women's health is structured and the lack of support and resources that are going on in the country. And while we know that as a whole, specifically at the postpartum period and really, as you talked about pregnancy and leading up to postpartum, how that can play such a significant role in the experience and how important therapy can be to navigate these challenges.
Yeah, absolutely. I would say, throughout my time of being a therapist, it seems like it's less about, oh, what's going on in your brain? Let's work on these cognitive interventions, but acknowledging the culture that we're swimming in. And sometimes that culture can be very toxic. So I think therapy is a wonderful place to kind of navigate that.
No, absolutely, absolutely. Well, thank you so much, Alex.
Yeah, thank you so much for having me. It was a pleasure.
You're welcome. Thank you.